afternoon, good evening, wherever you're watching me from. This is Dr. Mercy Mumba coming to you from Tuscaloosa, Alabama. I'm so excited to join you today and talk to you about the National Prescription Drug Take Back Day, which is happening today. I also want to celebrate another milestone. Some of you may be aware, but today is actually the 1-year anniversary of the official launch of the Center for Substance Use Research and Related Conditions at the University of Alabama. I have the honor and privilege of serving as the founding director for that center, and I'm just so excited to see the growth that we have experienced in the last year. I want to thank our community partners without whom we're not able to do the work that we do. Our research, our programs are having significant impact in the communities, but we would not be able to do that without our community partners, without the state agencies that support our work, without the affiliated faculty as well as staff, and the students who are being mentored by all of this amazing faculty who are doing excellent and innovative research in this area. Now, back to the National Drug Prescription Take Back Day, which is happening today. I wanted to give you a few facts that might be able to convince you of why this is actually important. Worldwide, we have about 11.8 million people who have a substance use disorder, and of this, about 11.4 million people worldwide every year die, and these are considered premature deaths. Most of them are preventable drug overdoses, and we have a lot of work to do in terms of drug overdose prevention, harm reduction, as well as treatment access and engagement for people with substance use disorders. As it relates to drug overdoses among kids, medications in the home are actually the leading cause of accidental drug overdose among children. Every year we see about 60,000 children in the emergency rooms related to unsupervised and accidental drug overdoses. This is absolutely preventable, and we need to do better as a community. So today is a resource that's available to all of us to make sure that we go into our cabinets, medication cabinets, and look at medications that we have not used in a long time. Some of them may even be expired, but they're sitting there in our medicine cabinets, and we need to do our part in making sure that we're promoting public health and also community health. We don't want our children to accidentally overdose, and there's also literature supporting the fact that a lot of teenagers and adolescents who are using drugs actually use medications that are within their homes from their parents, and now they become dependent on those medications or become addicted to those medications, and we need to do better as a society. So here's my challenge to everyone out there today. I shared a resource with you yesterday on all my social media platforms. If you go to that website, you're able to click a link that allows you to put your zip code in that website, and it will show you exactly where to take your medications back. This is something that is close and dear to my heart as a person who does substance use research work from the time that I was in my baccalaureate program all the way to what I'm doing right now. I know that prevention is definitely better than cure. We can do a whole lot more in terms of public health. We can do a lot more in terms of prevention and harm reduction, and we know that substance use disorders have far-reaching implications, not just for the individual but for communities as well. It is estimated that over $80 billion annually is actually spent related to substance use disorders when you think about hospitalization, when you think about lost productivity, and even the criminal justice system. It's very important that we do our part every day, and I know that there's a lot of stigma related to talking about substance use in our communities, and a lot of us just want to sweep it under the rug, but that is not going to produce the kind of change that we want to see, and that does not contribute to population health outcomes. So I challenge you today, wherever you are, to look in your medication cabinets, look at medications that you're not using, type your zip code in the website that I provided, and make sure that you make a plan to go and take these medications there so they can be safely destroyed, and that way you reduce the likelihood of children within the homes to overdose on these drugs, but also prevent adolescents and other young children who are inadvertently becoming addicted to drugs because they're taking medications in their parents' medication cabinets, and they just become addicted from that as well. So thank you so much for joining me today. I'm so excited. Like I said, today is a special day for me, 1 year anniversary for the Center for Substance Use Disorders and Related Conditions. That is a mouthful, but we're so excited about the work that we're doing. And I do want to highlight one of our affiliated faculty, Dr. George Mugoya, who is the PI on our DOE grant, which is a Department of Education grant, where we'll be training substance use counselors and social workers to actually improve outcomes in our school-age children, because we know that there's a lot of disparities when it comes to substance use, mental health, behavioral health in our school-age children, and so we're excited to be making a difference in that arena as well. So thank you for joining me today. Here's my call to action for you. Look in your medication cabinets, find medications that you're not using, take them back to those designated locations so they can be safely destroyed. See you on another episode